Are you experiencing intense emotions or behaviors that have not been helped by traditional talk therapy? Mark Becker is here to describe an effective treatment approach, dialectical behavioral therapy. That's next on Wellbeing Matters. MCPS colleagues, thanks for joining us for today's episode on DBT. Mark, thanks so much for being here today.
It's my pleasure. Thanks for having me.
Sure. So what is dialectical behavioral therapy?
I think most of us are probably familiar with behavior and therapy. I think it's really that first question, the first word that throws people off, a dialectic. So let me explain what a dialectic is. A dialectic is when you hold two opposing ideas that can both exist at the same time. And this is the fundamental idea of what the treatment approach is. And an example would be, most of us might be familiar with, I would like to eat my cake and I don't want to eat my cake as well. Or let's say with a family member, I love this family member and I'm angry with this family member as well. So the dialectic is that both of these statements can both be true at the same time.
Interesting. And so how is DBT therapy different from other types of counseling or therapy?
Oh, that's a great question. So in order to talk about that, I think it really helps to understand what the core dialectic of DBT is, right? The core two opposing ideas that both exist at the same time. So you can see above me is I put down acceptance and change. And the two opposing ideas is one, acceptance and understanding where a person is and where they're coming from, as well as moving towards change. The difference is in more traditional therapies, let's say psychodynamic therapy, more Freudian therapy, there's a heavy focus on acceptance of like, let's talk about what's going on and let's talk about what's going on. And there's such an overemphasis on the talking about what's going on. There's not such an emphasis on like the change piece. And then from there, treatment shifted moving towards a strong emphasis on change. We need to do something different, do something different, do something different. And DBT has really focused on there being a balance between those two ideas of let's talk and really understand about what's going on and moving towards change at the same time. So it's the idea of acknowledging both and having both exist at the same time.
That makes a lot of sense. Who is DBT recommended for?
DBT can be really helpful for people that struggle with intense emotions, depression, anxiety, trauma, anyone that's struggling with any sort of like behavioral issues or perhaps substance use. Avoidance might be an issue that comes up for us quite a bit. DBT can also be really helpful for people that struggle with interpersonal relationships or interpersonal conflicts with significant others, family members, colleagues, coworkers.
So Mark, I'm often asked, what can I expect in a DBT session?
Remember, we talked about that DBT includes that acceptance and change. So there's going to be some time that's going to be focused on learning and understanding and exploring what happened in your personal story, in your narrative over the course of this past week. So that'll be the first part of the session. And then the second part of the session then starts moving towards change. Now that we have a really deep understanding and validation of like, this is what happened, and it really makes sense that this is what happened. Let's see what we can do, something different, right? Because what happened didn't entirely work for you, right? There was a lot of emotional intensity. There was a lot of like pain that was there or something that didn't fit within your value system, and we want to do something different. So it's that acceptance and then moving towards change.
And what should I look for in a DBT provider?
Oh, so that's a really great question too. There are lots of people who talk about DBT. When you're looking for a DBT provider, there are some really core components of having DBT. The first part is going to be someone who's going to provide validation and acceptance, someone who's going to offer phone coaching. Phone coaching is the idea of being able to reach out to your provider throughout the week. And the third idea is going to be skills training. And I'll give you an example of how these different things come together. Let's say today is Thursday afternoon. Let's say our individual therapy session is going to be Thursday at 1. And then we have like a skills training session on Monday at 1. So that's a session on Thursday and then a session on Monday. What happens if it's like Saturday afternoon and you're really struggling? You can use something called phone coaching, where you can reach out to your individual therapist and your therapist will respond to you. They'll give you a call back. They'll send you a text saying like, hey, it sounds like you're really having a hard time right now. Have you tried strategies 1, 2, and 3 that we've talked about in the past? Because I know they've worked for you. Why don't you try them and then give me a call back? Let me know how it goes.
Very different from traditional talk therapy. And what I hear from you is some very useful tools.
Yeah, it's very specific and very concrete. It's also very different than other approaches. In other treatment modalities, when someone is struggling, they may encourage them and motivate them to go to the hospital or to go to a higher level of care. And in DBT, our approach is more of like, wow, it sounds like you're really struggling. Why don't you take a seat and we can talk about to really understand why you're struggling and what's leading to that. That really makes sense. I really get that. Let's see what we can do to change that, right? So it's a little bit different because I know you don't want this anymore. And I don't want this for you either, right? So let's see what we can do differently. So it's very concrete, it's very specific, and very practical.
Mark, thanks so much for being here today and for taking time out of your busy schedule.
It's really my pleasure. Thank you so much for having me.
We would like to take this opportunity to thank Dr. Elizabeth Rathbone. Dr. Rathbone, you helped create Wellbeing Matters, and you've been a big supporter of the series. We wish you all the best in your retirement, and we will miss you greatly. Remember, the Employee Assistance Program is here for you and your family members. We hope you found this episode useful. Perhaps DBT can help you or someone you know. Be well, everyone, and see you next time.